you. Okay, so for today's video, I am doing something really cool and exciting, and I have a guest with me. This is Lex, and we are going to talk about a forum that I went to recently and some of the issues surrounding it and why this is important to us at all. So we went to, or I ended up going to the forum, but it was from Community Care, which is an organization in Austin, Travis County. I don't know if they're...
Yeah, so Community Care, they only serve residents of Travis County. And Community Care provides health care to families and individuals that probably fall into the lower income category in Travis County. So Tina was saying that she had the opportunity to go to a forum. Unfortunately, I didn't get to go due to my own health. But that's just another reason why I want to be here and kind of talk about why taking care of yourself is important. Yeah, let's talk about the forum a little bit.
Okay, so they put on a forum. It was during the afternoon, and the goal behind this forum was basically Community Care's way of saying that how can we address health issues that the LGBT community sees, which is huge for an organization of that magnitude and that size to be able to say, hey, we think that there are things we can be doing better. How can you guys, the actual population, tell us what's going on? And that was definitely the environment of the forum. It was a really open, and people were talking about things that they've seen. So they went in through a little bit about the forum. They talked about what Community Care does, and then some of the major points that they hit before they opened it up to questions was that they offer services for HIV and AIDS testing, and they also offer services for PrEP. And they give us a phone number that I'm going to include in the description that they said if any of these services sound like something that you know, maybe you don't have insurance, maybe you don't really, check up on your health, and you're like, I'm going to start fucking worrying about myself. Give that number a call, and they'll walk you through the steps on what's going to be the best way to appropriately address your needs and point you in the right direction. So where the LGBTQ portion of this comes into play is they wanted to know what issues does our community face that they need to address differently. And so some of the major themes that came up were we talked about and asked the question about individuals who are transitioning, what services do they have available? And they humbly said that they are not at that place where they're offering any healthcare services at this time for individuals transitioning, but they were working with another organization that's here in Austin, Travis County called OutYouth to start that process. And so just hearing that is huge as well. They also talked about another topic they talked about in general was I remember asking, like, what does the Community Care look like? Do you guys have bathrooms that are only male and female, or do you guys have some neutral bathrooms? And they were like, yeah, we do, like, we changed that recently. And I was like, so it was like from big scale, how can we change like the service that we're providing, even down to like making sure that the patients and the clients that come in feel comfortable doing that. So that was one of the things that they talked about. They broke us up into groups, and they let us hit on specific issues that we felt we saw in the community. And we kind of talked about some of those earlier.
Yeah.
Do you want to hit on, I don't know,
well, one of the things before the forum, I posted something on my Facebook to reach out to, other friends in the community, in the LGBT community, be like, hey, like, what are some of the experiences that you've had going to the doctors, if it's related to any type of LGBT issue. And a few of the things that really started the conversation, were services for people that are transitioning, and to see that Community Care is making those steps to get there is amazing, and that's something that, even though it hasn't happened yet, we're glad that it's moving in the right direction. But to even build up on that, we want to help our community and Community Care figure out ways to provide the LGBT community the best way possible. And a lot of that is going to start with providing training for their staff to make sure that when people go get services, that it's not going to be awkward, that they're going to feel comfortable talking about the issues that they need. And then not just people that are transitioning, but what are some things that women go through that identify as lesbian or bi, and men that identify as gay or bi, or there's a whole spectrum of people that the LGBT, we try to umbrella them into this category. But am I getting off topic?
No, this is perfect,
Okay.
because that was a big part of someone's suggestion, was like, we also would love for your staff to have
sensitivity training.
Sensitivity training, yeah, just to be aware of, how do you properly address people? How can we make sure that we know what's going on, so that as people come into our clinic, this isn't the first time we've heard about these type of health things. We know that this is something that this population is dealing with. So a huge thing was sensitivity training for the staff. On that same token, they talked about the actual doctors that they partner with as well. One of the suggestions I had was that back in, I think, like 2012, when I was searching for a healthcare provider, my insurance had the option on the website to filter by LGBTQ provider. And to me, that was huge, because I wanted somebody that I felt comfortable with. And for a provider to come out and say that, they were part of the LGBT community, or that they were, they welcomed patients. That was huge for me. And so I made that suggestion, and they were like, oh, that seems like such a little thing. And I was like, it is, and it could be. But for somebody that, is dealing with health issues, that maybe are concerned about some of those
services,
things.
It's going to be really comfortable for the person that's seeking the services to know, like, oh, the doctor that I'm going to go see tomorrow knows other people like me.
Yeah.
They're aware of situations that I'm also going through. And I think that's huge for anybody that's going to get services, is to know that where you're going, they're informed, they're educated, and they're open to ideas. And they're open to, building those discussions and having those conversations to see how they can provide better service to the community, but, today particularly the LGBT community. Yeah. And so I think I'm excited. I have worked with other agencies that partner with community care. So when I heard that community care was doing this forum, I was super pumped. Tina actually told me about it, so I was like thrilled that there was even somebody else that I know and care about that was also going. But I think...
Well, let me ask you this. Okay, so one of the last things that we kind of want to talk about was, why is this important to us? Mm-hmm. So I can either go first, I'll let you go. Why is an organization as large as Community Care and them focusing on this population, why is that important to you specifically?
Well, for me, I've had health issues, since my mom gave birth to me, and the fact that Community Care is trying to figure out how to serve individuals better, but also to figure out how they can support the community. Because, as a child, my health concerns not only affected me and me as a person, but my family and my friends. And it was really helpful when the doctors provided all of us with information on how to deal with whatever I was going through. But more importantly, I think with Community Care and with them providing services for the LGBT community here in Travis County, it's huge. I don't think a lot of people in other states and other counties have an agency like Community Care that's, willing to have these conversations. You would think and you would hope that many people are having these conversations, but the reality of it is it's not happening. And so for Community Care to step up, especially in the state of Texas, to say, hey, not only are we wanting to overcome obstacles with just providing healthcare, period, in the state of Texas, but we're also extending these services to the LGBT community. So I could go on and on about why I think this is important to me, but I think just there's so many hurdles with healthcare and with people that fall into LGBT spectrum that I'm thrilled that Community Care is starting to make these steps. And I think it's going to be make a huge difference to the community overall.
Awesome. For me, why I would say this is important for me, I am and have always been dealing with some health issues, and for me it's been mental health, and that was always a hard thing for me to want to look for in a healthcare provider, because I felt like a lot of the stuff that I needed to work through did concern the fact that I am in the LGBT community, and I wanted somebody who knew and who supported it and who didn't ask me questions that made me feel uncomfortable because they just knew. And that's just where I was when I started that process, when I was looking. So what's cool about this type of thing and why this is so important for me is because since I started doing these videos, I've had friends and family reach out to me just asking questions about just things that once you've immersed yourself in the community and you've continued to kind of just develop resources for yourself, you kind of forget that not everybody's aware of these resources. So why this was important for me was to just put it out there that here is an organization. I'm sure that there are other ones, but I just wanted to give a shout out to, you know, Community Care for having that forum for us to be able to come in and still say, hey, our community's still affected in this way. So that's why it was so important to me, because I think that I've been assisted in the last couple of years to be able to feel more comfortable when it comes to my health and access resources, because there were agencies that are, you know, having forms that you can filter by LGBTQ, or having a big sign, or part of their promotional marketing video for their healthcare program has, you know, a couple of lesbians in it or men. So whatever it is that they're doing that they think can kind of help this population out. So I want to thank you guys for taking the time to listen to us. I'm going to put the phone number to Community Care in the description. That is the number that they've told me to give if you are interested in providing any of the services we talked about. They'll point you in the right direction, and we'll also provide other resources in the description that we just know about in terms of health issues and things that we know and that we use if you guys are interested. And other than that, thank you guys for listening, and stay healthy.
Yeah.